Addiction is definitely a disease, and what really baffles the people who are plagued with the disease, and when I'm talking about people who are plagued with the disease, it's not just the addict per se, but the entire family begins to go through the consequences and the damages of addiction, and all of them are the least perceptive, least sensitive, because what really is evident is judgment. They are judging the addict to be a weak person. They are judging the addict to be a bad person. They are judging the addict to be a immoral or a immoral person who is not able to make the right choices and understand the consequences of what the addiction is causing in his life. They see a person who has to just make the choice of not using the substance, and at the other end is the person who is grappling, who is dealing with an illness which has biopsychosocial perspective, the biological perspective, the psychological perspective, the interpersonal and social perspective. And amidst this biopsychosocial perspective is the essence of damage, the quantum of damage, with least empathy, least understanding, and least perceptiveness to understand that what the addict needs is sensitivity, empathy, and treatment. And none of this is visible to the family. None of this is visible to people. None of this is visible to the society. They want to judge, to see the addict as a bad person. The addict is not a bad person. The fact that you, as a viewer who's not directly implicated or afflicted with the disease of addiction, to my understanding, is also a mere accident. The way if you're not diabetic is a mere accident, the way you are not an addict is also a mere accident. It's just that you don't have the biological predisposition, or you have the biological predisposition. And if you have the biological predisposition, and in hindsight, unfortunately, the parameters to diagnose addiction only become evident in hindsight, in retrospect, when the disease has already begun to unfold itself. So the biggest analogy or the example that I often like to cite is that once the mango has been pickled, you can't undo the pickling process, but the pickled mango is more precious, is more advantageous, is more expensive. Similarly, when people are diagnosed with the disease of addiction and they decide to work on themselves, they decide to seek treatment, it enhances into them a dimension of their personality, a dimension of spirituality, which in the coming months and years changes and enriches the spiritual fabric of their essence. And when they look back, they are able to not only practice recovery, they are not only able to practice abstinence. What they are able to practice is complete holistic growth of recovery. And in this recovery, there is happiness, there is peace, there is tranquility, and there is a lifestyle change which empowers them to be more powerful human beings. So the time to seek treatment is now, because once the wood is infested with termite, with passing delay, the wood is going to get more and more eroded. The wood or the termite is not just going to leave by wishful thinking. So it is not wishful thinking that's going to cure you or treat you from the disease of addiction. What you will need to do is to take action. And that action comprises of the best practices being the best practices of treatment.